territory I'm learning about. So I hope you are too. So, anyways, I was saying it was really lovely to be invited to speak to you all, and as in the intro, you heard background in clinical background in the NHS, background public health in primary care trusts, and then in local authority, and now DCMO nationally. So in all of those settings, research and developing the evidence base has been really, really critical, really important in terms of improving population health. And I think now, particularly as DCMO and co-lead of OHID, to really reinforce that, you know, research, the evidence base is just absolutely critical in terms of the work that we're doing nationally, regionally, locally to improve population health. So I think it's a great opportunity now with OHID to look at how we can really influence. We're much closer into government, and we have now more levers, I think, to act. And there's greater awareness, greater interest from ministers in public health with COVID. Now is really the opportunity and the time for us to try and bring about some real changes, step changes in population health. But as you know, you know, with COVID as an example as well, the intelligence and the evidence base to inform the decisions made by politicians is absolutely critical. So your focus on the evidence base, my focus on what is the evidence base. We've got two very aligned views on what's important, what's needed. And I know that you worked closely with Public Health England during this second phase, and really keen that in OHID we continue to build on that close relationship that you had. And honestly, there's just been, just listening to the presentation of the strategic plan, just been some fantastic advances, I think, for public health research over the last years. And it really looks like we continue to develop and grow in the way that we need to. I know that health inequalities have always been a core aspect of the school's work, but I'm really pleased that that's being enhanced in this next phase, because I think OHID is called OHID for a reason. It's got disparities in the title, and from our point of view, disparities and health disparities, health inequalities are, we see them as the same. And as I said in my intro, the opportunity to influence government policy around just health disparities, we've got a real opportunity to do that. And so I see that as really important in terms of continuing to develop the research and evidence base around that. And as you, I'm sure, are all aware, we've got the white paper Health Disparities, which you know, the publication is in the next few weeks. We're hoping for it to be pre-recess. But on, you know, having been part of the experience of developing that, I can absolutely affirm the core function of the evidence base in terms of how we can really clearly advocate for certain policy decisions that or choices that politicians have. I think in terms of that, there will be specific policies in there. There will be hooks around exploring, considering, piloting, those kinds of that kind of language, where I think are indicating the challenges that we have, but opportunities, and again the importance of the evidence to move those areas forward in terms of getting to some policies and decisions. I think what's been important, what you'll see hopefully, is a acknowledgement of a shift from the focus just on the individual to populations, And I think the research evidence base, the look at how we evidence on population policies is really going to be quite critical to help support that shift, which we all know is a really important one. The role and the responsibility of the state, its policies, its levers, how it works with industry, on collectively how we support a nation to be healthy. All of that, I think, will be signalled through the white paper. And so I think signal where we need the research and evidence base to help continue to push to improve population health. So I think that's where our role is really quite important. And clearly ministers quite rightly decide on the policy, but having the evidence base on which to do that is really important. And that's where you come in. So it's really important that we join up in terms of the research that's done, and how that then informs improvement of population health and policies around that. So I like to think of the two broad areas of research. It's how I look at the broad areas of research that policymakers use. So there'll be policy requested or shaped research and researcher-led research. And that's where we are, so that's where we as policy officials or those informing the policy decisions are part of how we shape the research ask with yourselves. And I'm talking from national, but also local. So the whole interconnection with local government and local NHS, that's really important. So it's working together, commissioning, helping set direction for the research. So that's really important around policy requested or shaped research. That's the first area. And then there's yourselves as researcher and the researcher-led research. And I think that's important as well, where you are producing data, doing research that will be drawn upon to inform policy, perhaps when there isn't an imminent policy request or question, but it will inform and shape the future direction. And clearly there's no clear firm line drawn between the two, but I do think they're slightly different. We don't always know what answers we're going to need in the future. So I do think drawing on how a body of evidence is naturally built over time is really quite important, and again helps shape what our future policy asks or questions might be. So I primarily wanted to thank you all for your role in providing the hard research evidence that we can use to better shape policy. And I think so much of your work is going to be crucial to OHID. I intend for us to work really closely together. I think we will align well in terms of our approach. And I think I did manage to listen to a few of the presentations yesterday, some a little bit live, but actually last night looked at some of the videos, which is exploring this new way of doing conferences. And it really struck me that the approach that you're taking really does align with our approach. And so making sure that we've got OHID and SPHR working very closely together, I think is really important. So some of the things that struck me just by looking at some of the presentations yesterday was that co-production with local authorities to answer some of the most important questions locally, the focus on evaluation, and certainly over all the years that I spent in local government, there were so many opportunities that it just felt such a shame that we hadn't evolved a way to ensure that research and evaluation was integrated with what we were doing in local authorities. And just so many natural experiments, policy experiments, so many interventions, so many areas that were just begging for research. And I'm really excited about the way in which that area has really evolved over the last few years. And I think for me, it's also that the critical to that is the thinking about not only how is this in one place, but how is it generalizable, transferable, scalable across geographies, while still understanding and appreciating that that actually part of the complexity of a local place is what does or doesn't make something work well. So it's complex areas, it's complex stuff, but I think it's absolutely critical that we do grapple with some of those complexities and ensure that we can learn and improve and support local areas to learn and improve and do things better. And I would say, in terms of OHID, that a lot of the innovation and the work that's done locally absolutely informs national policy thinking. So it's absolutely critical for us that the work that's done locally is researched, is evaluated, and that it spins back up to national policy decision making. So that's the first day, that I just noticed there were quite a few examples of that great co-production with local authorities. I really like the developing the diverse cadre of early and mid-career public health researchers with skills and experience. And it's that ability to have a career both in academic and in practitioner-based research, because I do think that's really important, having that knowledge, experience, understanding, lens of how the research, the evidence-based links into practice is really important. And there was some input from trainees who based both in local authorities and doing research. And I think bringing those two together in the training program is quite important, because I think, my experience I'm talking quite a long time ago, is sometimes, the trainees who are doing academic work and then local authority, the two just didn't seem particularly connected at all. They were sort of two completely separate spheres, and that can't be right. We need to bring those spheres together so that they are complementary. So I think it's great for us to draw upon those insights and that work, and the trainees to develop those skills and insights as they go through their careers and become more senior in their careers. So it's great to have those that multidisciplinary interaction and integration between praxis and research. It's really great. And then the third point I wanted to make was just around the reach across. Well, yesterday there was research, wasn't there, about social housing and other wider determinants research, which again is really important in terms of the wider determinants work. OHID wanting to reach across government. So we've got the Prime Minister's Health Promotion Task Force, which is one vehicle for doing that. You'll see in the white paper that clearly there were lots and lots and lots of conversations across different government departments. The research base to enable our OHID officials to have those conversations with officials in, whether it's DLUC or the Treasury even, or Home Office, Department for Transport, all of that, having the evidence base to advocate for particular policy choices is really, really important, again, in terms of that. So it really fits with your aim to increase input from the other academic disciplines, such as engineering. So the work that CMO is interested in around air quality, clearly, we need to draw on the research of quite a wide range of other disciplines, that an interdisciplinary nature or multidisciplinary nature of the research is quite important. So very pleased to hear about looking to fund and develop more that broader interdisciplinary workforce. So I think the public health challenges that we're facing do require us to have a much wider sense of those different, the input from those different disciplines. So lastly then, I wanted to just briefly set out some of the ways that in OHID, some of our priorities, they map across nicely to the strategic priorities that you've set out, of course. And so just in general sense, I think it is about both strengthening and supporting the public health system. And I think I've spoken to that. So it's definitely one of our priorities. And the public health system, as I said, does include the way in which we link across to you in the School of Public Health Research and research more broadly. So I think that's really quite important. I think there's some key policy areas that that are picked up as part of your strategic plan that will be really important to us. The white paper will signal, as I've said, some other key areas where research is going to be really quite important to us. So that system strengthening is important, ensuring that we've got effective delivery from the national to the regional to the local. And there was examples of research I saw yesterday around delivery and delivery mechanisms and evaluation of that. So I think that's going to be really quite important. They'll focus on the workforce and ensuring that we take the workforce forward with us. Yeah, so I think I'm going to stop there in terms of the priorities and see whether we've got, I hope I haven't overrun, but see if we've got some time for questions. Oh, sorry, you're on mute yourself now.
Thank you very much, Jeanelle. Sorry about that. That was a really helpful overview and really appreciate it. I think we have at least one question. So Monique is asking, I think you've partially answered this, but asking how can we as a community best work with OHID to ensure that our work has impact?
Yeah, so on that, I think, so working through the School of Public Health, and we clearly as OHID have those links to the school. I think so just being part of the school is quite important, and the university is connected into that. I think having those relationships, in the areas of expertise and ensuring that you have that link through into OHID regions. I think our regions are really quite important. So it depends a bit where your research is based and what kind of research it is. So it might be that you would link into particular regions or networks like Fresh on tobacco. So there's that kind of link, isn't it? And I think that's quite important because the regions in turn will be very much integrated into the national OHID work. There might be particular policy areas where you would want to have a relationship into national policy teams and so on. I really do think that kind of relationship and being close to really understanding what it is and where those what kind of research is needed, what the areas of the research are, being able to see where different policy choices are going, what opportunities there are in terms of making a difference. I think all of that comes through the stronger relationship between the research community and the practitioner community, between the school, for instance, here and OHID. I really do think that, which is why I'm really pleased to have been able to come and speak to you directly.
Thank you, that's wonderful. And we've also got a question from Ashley asking about whether you could say a little bit about how we can facilitate and reduce burden to OHID, barriers, to data access for research through OHID.
Okay, so that's going to take more than I
guess highlighting it as an area to discuss, maybe.
I highlight that it's an area to discuss data, absolutely. Yes, exactly. No, so very keen to that we're involved in some of those data discussions as well. And if there are things that we can do to help facilitate, then it's absolutely critical that we know about that and what it is that we might be able to do.
Thank you. I don't see any other questions. Unless I'm missing them, I will say thank you very much again, Jeanelle. And it's been really a pleasure to see you here, and thank you for representing OHID and working with us through SBHR.
Thanks so much, and lovely to be able to speak to you. Thank you.